Well, good afternoon. 4 short weeks ago, the first doses of the Pfizer vaccine arrived here in Ontario. 3 weeks ago, the first doses of Moderna vaccines were approved by Health Canada. And in a short period of time, our hospitals and the task force have moved mountains to get these vaccines out to our long-term care homes. We brought long-term care workers to our hospital sites. We found ways to move the Pfizer vaccine. We rapidly expanded vaccination capacity, working hand in hand with our partners to secure mass vaccination sites like a hockey arena in Newmarket in the Metro Toronto Convention Centre. We have a well-oiled machine led by General Hillier and your task force, and thank you, General, and the task force. In fact, we have delivered over 226,000 doses to date, more than any other province in the entire country. And we are capable of scaling up to administer 40,000 doses a day and beyond. We have the capacity, and we are in desperate need of those vaccines from the federal government. The news from the federal government today that Canada won't get any new Pfizer vaccines next week, and far fewer than expected in the coming weeks, it's troubling. It's a massive concern. My message to the federal government is that nothing else matters right now. Every day we're giving out less vaccines than we have the capacity to administer is a day we lose. Because this vaccine is the difference between life and death for our most vulnerable. But despite limits on the supply, here in Ontario, we have made incredible progress in the span of 4 short weeks. We're emptying the freezers on what we have received so far. We're getting needles into people's arms, and we're focusing on our most vulnerable. Earlier this month, we set a target of getting all long-term care homes in our 4 hardest hit regions vaccinated by January 21st. And today, I can announce we have hit this target ahead of schedule. In fact, we have completed the first round of vaccinations in over 40% of all long-term care homes in the province. We have finished the first round ahead of schedule on all long-term care homes in Toronto, Peel, Windsor, and York, our 4 hotspot areas. We've also completed the first round of vaccinations at all long-term care homes in Ottawa, Simcoe, Muskoka, and Durham. And many more regions are making great progress. Across the province, over 83,000 long-term care residents and the nurses, PSWs, and staff who care for them have received the first dose of these life-saving vaccines. And we are well on our way to meeting our target of delivering these vaccines to all long-term care homes across the province by February 15th. My friends, this is the first of many victories against this deadly and ruthless enemy we face. We will not rest until every single long-term care home and all Ontarians who want a vaccine get it. But all of this rests on getting the vaccines we need from the federal government. And we're prepared to do whatever we can to support them on this. My friends, we will get through this. But until vaccines are more widely available, please stay home, stay safe, and save lives. Thank you, and God bless the people of Ontario. Now I'll pass it over to Minister Fullerton.
Thank you, Premier Ford. Today we mark a tremendously important milestone in the fight against COVID-19. We have gone into the communities where we know there is the highest community spread and administered first doses of COVID-19 vaccines to willing residents, staff, and essential caregivers in long-term care homes. Just think about what this means, not only for everyone's safety, but for the peace of mind in knowing our loved ones are better protected. This would not have been possible without the partnership of medical officers of health who are leading the local rollout of the vaccine in their public health units, as well as the dedication and hard work of our frontline healthcare teams who are going into long-term care homes to administer the vaccines. It's been incredible to see the stories they've shared about the optimism being felt as they visit one home after another, day after day. You made this happen and even delivered ahead of schedule. Ontario will continue to drive forward with rolling out the vaccine. We're making significant progress towards our goal of reaching all long-term care homes by February 15. Today, more than 83,000 residents, their essential caregivers, and staff have received at least a first vaccine dose. While the vaccine has given us hope, we cannot let our guard down. Our government is doing everything we can to protect our most vulnerable. Since the pandemic started, we have invested $1.38 billion to support our long-term care homes. We've taken action to address urgent staffing shortages, including issuing management orders, enabling the deployment of hospital staff, and the use of infection prevention and control teams. But the fact is that the rise of community spread during the second wave is posing a serious threat to our long-term care homes. The single most important thing we can all do right now to protect our most vulnerable is to stay at home as much as possible. As we continue our vaccine rollout, this is our best defense against this virus. Let's work together to stay home, stay safe, and save lives. Thank you. And I would now like to invite General Hillier to say a few words.
Minister and Premier, thank you. And ladies and gentlemen, all of us involved in the vaccination rollout mission here in Ontario have been somewhat frustrated, no, a lot frustrated, by our inability earlier on to get into the long-term care homes, the high-risk retirement homes, and provide that level of protection that we wanted to the residents and the essential caregivers who work in those homes. We were constrained by having only Pfizer, and Pfizer could not be moved from our point of receipt. And then things changed. We received the Moderna vaccine, which we could start moving to those long-term care residents and high-risk retirement homes, and we started doing exactly that. And then we got permission with Pfizer after we developed the protocols to move the Pfizer vaccine from the point of receipt, and we started using that vaccine. We took up the Premier's challenge of completing all of the long-term care homes and high-risk retirement homes in Toronto, York, Peel, and Windsor-Essex, 163 homes, and doing it by the 21st of January, and we've completed that. And you saw perhaps a tweet and an acknowledgement from the City of Toronto on Friday past when they said they have done all 80 long-term care homes inside the City of Toronto, a collaborative effort with the Public Health Unit, the Medical Officer of Health, the City, and the hospitals to ensure that those residents were looked after. But in addition to that, they had also done 70 retirement homes that they considered at risk. That part now of the chapter is finished. We will continue, obviously, into phase 2 to go back with second needles for those residents and essential caregivers. But in the interim, we are now concentrating on rolling across the rest of the province and doing the long-term care homes and high-risk retirement homes, giving the opportunity to the residents, the essential caregivers, and the staff to get that vaccine. And let me just tell you, we have all seen a little bit of the emotion that comes with that vaccine. This is the only light in the COVID-19 tragedy right now. And just one example last week was a woman in her 90s who was receiving her first needle in the vaccination, and she had her entire extended family on Zoom with her to observe, to witness, to be with her when she got that first vaccination. You talk about an emotional moment for everybody, and we draw upon moments like that to inspire us as we work those long days, as all those healthcare professionals do what they do so well, looking after the people with such tenderness and such compassion. We all draw upon those inspirational moments every time we get tired. We want to do the rest of Ontario's long-term care homes, building on the success in those 4 regions, in Toronto, in Simcoe, in Durham, and building on that success and have all those homes complete by, obviously, 15th of February, as the Premier has said. We think we can do it, even with the reductions in vaccines, but each day we will work through the numbers really carefully to ensure that if we cannot, we will tell you that. And if we cannot, it will only be because we don't have the vaccines. Going forward over this next 4 weeks, given the numbers that you know, our allocations will be almost completely allocated to second needles as the days come available, and to those residents and essential caregivers in those long-term care facilities. We've already started outside of those regions, though, and a week and a half ago, we started in long-term care facilities in isolated fly-in communities in Ontario. And we started with 3 small long-term care facilities, 47 out of 51 residents vaccinated, plus the essential caregivers. We started in Sault Ste. Marie, in Sioux Lookout, with 2 long-term care homes and the medical staff in the medical facility there. And we will continue, because we vaccinated those that we want to carry out in those isolated communities, the vaccination, and they will be ready to go as of 1 February to continue that vaccination program in those 31 isolated communities in an operation that we are calling Operation Remote Immunity. So we take those little victories, we cherish them, we get inspired by them, and it just reconfirms our dedication to execute this mission for the people of Ontario. Thank you.
For the phone line for questions. First question, please.
From Ashley Legasic at News Talk 1010. Please go ahead.
Hi there. Thank you all for taking my questions. Premier and General Hillier, with the news that Canada will not be receiving Pfizer vaccines at all next week, how angry and frustrated does this make you?
Well, before I pass it to General, it makes me very, very angry. And I want to make something clear. Angry at the Prime Minister, Deputy Prime Minister. We've been working collaboratively. I'm just angry at the situation that other countries are getting at. And nothing is more important than getting these vaccines. And if I was in his shoes, I'm sure he is doing it, but I'd be on that phone call every single day. I'd be up that guy's yin-yang so far with a firecracker, he wouldn't know what hit him from Pfizer. I would not stop until we get these vaccines. Other countries, small countries, where in the world of